Hello, my name is Dr. Ibi. I welcome you once again to this channel Beyond the Consulting Room, where I talk about issues that concern your physical health, your human dignity, your self-development, and your overall well-being. In this video, I want to talk about alternative medicine and whether they work, alternative practices, whether they work or they do not work, whether they are safe to use or they are not safe to use. And it's because there are many people when they face medical conditions, they have a health problem, they are confused as to what's going for, whether they should go in for homeopathy, naturopathy, orthodox medicine, herbal medication, divine healing. They are not sure what's going for. And some have landed themselves into trouble, making wrong decisions, wrong choices, and they came to the health facility with complications and as emergencies, and some even came too late. All right. Now, if you are medically trained, your disposition is to judge such people and be wondering why would somebody intentionally sponsor himself or herself on a suicide mission. That is not the case. All right, these are people who are genuinely looking for help. They are desperate, they are vulnerable, they lack medical knowledge. Orthodox medicine sometimes has told them that, or has admitted that there is no cure for their medical condition, so they have to try options. And then when there are juicy offers and enticing adverts, they are tempted to patronize this kinds of treatment options and land themselves into trouble. So it's not a case that people intentionally take money out of their pockets to buy trouble for themselves. Okay, so what I can do, for instance, is to do a video like this to educate you on the various healthcare systems that are available. And this book, The Right Treatment, I'm picking my thoughts from this book, The Right Treatment for the Right Disease, that talks about all these various healthcare systems. Okay, so what is alternative medicine, or what are alternative practices? There are two schools of thought that are at loggerheads, that are competing with each other, that are conflicting schools of thoughts, okay, that are trying to define alternative medicine. One school of thought believes that alternative practices or treatments are those treatment options that are not included in orthodox practice. In other words, orthodox practice, that we sometimes call mainstream medicine, is refusing to recognize these treatments as proper treatments, and so they are not accepted in orthodox practice. Okay, orthodox medicine is biased towards these treatment options, so then they can make a decision to be practiced. Okay, the practitioners can make a decision to practice them, therefore, as alternatives to mainstream medicine. Okay, the second school of thought believes that, look, every promising treatment option or intervention was considered as an alternative to a current best method that is working. All right. However, we have to take that new promising treatment, okay, through some drill, through some tests, experiments, research, so it can prove itself that it's safe to use, that it works, that compared to a current method that is being used, okay, it demonstrates activity that is safer and better, right? That is all. So with this school of thought, the thinking is that alternative treatments are treatments that have not been proven to work, or they have been disproven, and so they could not have been accepted as medicine into mainstream medicine or medical practice. If people choose to practice them as alternatives, well, that is up to them. If people choose to patronize them as alternatives, that is up to them, but they don't qualify to be included in mainstream medicine. Okay, now with what I've just said, one will be thinking, these are just factions. Okay, why don't we just join one and leave the other? Let me join the alternative group or join the other group. All right, I am not going to encourage you to do that. Okay, For you and I, the question that we should be asking ourselves is this: if I fall sick, let's say I am a doctor, but I can, I mean, adopt the disposition of a patient because I am human and I'm prone to human diseases. If I become a patient or if I feel ill, the question I should be asking myself is, what treatment option is out there that is the best, all right, that a human being could have currently on this particular condition that can relieve me of my suffering and pain and save my life? I will not be thinking that it has to be herbal or it has to be some other medication. It should be the best I could ever have that can deal with my situation. I have only one life, okay, and I will not use it as an experiment, all right, by taking sides, okay. Then, if I adopt the position or the disposition of a medical practitioner, then also I should be asking myself, if somebody comes to me, the patient is ill, is suffering in pain and some discomfort, what treatment option is there that is the best I can give to this patient at this particular moment that can relieve this patient of his or her suffering and save the patient's life? I'm not going to be thinking of joining factions. All right. The only challenge is that for us to be able to decide on a treatment, there must be some proof that this treatment works. And so we are not going to be the first subjects of experimentation. I'm not going to experiment a medication on you as a patient and rely on you to give me testimonies to prove that it works. I am not going to allow myself to be a subject of experimentation unless I am being involved in some research. Okay. But as a consumer of health products and services, I will first recommend that that particular medication should first be tried in the lab, not on me. Try it in the lab, okay, in test tubes. When you finish, go to animals, okay, in animal studies. Now, establish that it is safe to use in the animal. Whatever you want to see in the human being, it can do in the animal. Then decide on an acceptable dosage, okay, that it is safe to use in the human being. Then now, under some controlled condition, we call research protocols, okay, you introduce that, I mean, carefully in a human being, monitoring and looking out for its efficacy and its safety. Okay. Then I'll say that, wow, this medicine is actually going through drills, okay, to prove itself that it's an actual drug. And when I take it, I'm not afraid. All right. Then also, there should be the possibility that there could be some competing explanations why a person can feel well. So this medicine must be tested against a placebo. So that when somebody is well, we are not going to say that it's a placebo effect. We are not going to say that the condition resolves by itself, is self-limiting. We are not going to say, well, the person was doing exercise and the person was eating appropriately, so that is why the BP came down or the sugar reduced, and it's not because of the drug. Okay? We should not also be thinking that somebody is giving false claims, misrepresenting information that I feel well when that is not the case. Okay? All these rivalry explanations why people can even feel better should be eliminated in this research. Then we can give credit to this drug and say that, look, this drug is probably an actual drug. That is not the end. Remember, there were medications that were being given, okay, to treat conditions before this drug came. All right. Now, we have to compare this treatment with these old medications and see if it demonstrates activity better than even any of these old treatments. Okay. In some cases, let's say in some jurisdiction where chloroquine was being used to manage malaria, it was discovered that the organism developed resistance, okay, against chloroquine. So we needed new, improved treatments. So they came up with the artemisinin-based combination therapy, what we call the ACT. And when the ACT was brought in, we did not say that we're going to practice this, use chloroquine alongside ACT. Okay, we actually discarded this chloroquine. So it can come and replace an old drug completely. But in some cases, it does not do that because they are going to be, because of technology, they are going to have new medications, new molecules that are very sophisticated and very efficacious and safe, or safer than older ones, okay? But we can use them as some first line medications that are actually expensive sometimes. However, in the absence of this new one, the old ones that are working already can be used. So they are not discarded, all right? But the point I'm making is that, look, every drug must first pass the test that it works and is safe to use, and must be compared to old medications to prove that it's any better than what we are already using, okay? The challenge you can face as a layperson who is not medically trained is how to know if a drug is researched. It is not your business to say that when I go to the health facility, a doctor is giving me medication, I want to ask, is it research or not? Okay. That is where you have to rely on experts. If personally, I know how lawyers are trained. I know where lawyers are trained. I know where they work. They work in the court. Okay. So you should also know that there are health experts and know how they are trained, know the categories and know how they are trained, where they are trained, where they work, all right? If a patient is being transported in an ambulance in a critical condition, where do we take that patient to? Probably there is some superior knowledge, health knowledge, all right, available at where that critically ill patient is being taken to. Okay, these are some of the things that should guide you, all right? Don't expect me to come and tell you that choose this or choose that, and then you accuse me of being biased because I'm an orthodox medical practitioner. What I can do for you is to give you information. And I think I've given you enough information to make the right decision and to make the right choice when the need arises, okay? For your own safety, all right, and for your own health, okay? Subscribe to this channel and also share the video to help somebody. And visit my website, www.drab.org. Thank you.